In low-income communities throughout the country, grocery stores and healthy food venues are moving out. This is leaving these communities plagued with obesity, chronic disease, and lacking the nutrition that they need to live healthy lives. Durham County is reversing this trend. The government is partnering with community agencies and convenience stores to create a healthy food environment for all of our residents.
Over the years, the health of the Durham community has improved in some respect. We see fewer deaths from chronic illnesses. In fact, our death rates have gone down fairly steadily over the past 5 years. But today's children's eating habits have changed enormously because of the proliferation of fast foods, restaurants in the area, the schedules of their parents, the schedules of the children have changed tremendously over time. And everybody is just on a fast pace, and people don't take the time to prepare meals and to sit down with families in the evening and have that conversation over a home-cooked meal. So if the community continues down the path of these unhealthy eating habits, we're going to continue this enormous public health epidemic of obesity. And as a result of obesity, we'll have more chronic illnesses being diagnosed, and people having to adjust their lifestyles in order to have a better quality of life living with those illnesses.
The role of youth in community change is a very important one. I think they are the ones that can really get things done. First of all, everyone wants to hear what a youth has to say, but they are the future generation, and so they have to learn how to be invested in their own futures. There's lots of ways that youth can get involved. My organization, Together for Resilient Youth, has a youth coalition that's Bans Against Destructive Decisions, BAD. And what the young people like to say is, it's good to be bad. Well, the way that they can get involved is to find out what their passion is and to learn what it is that they're interested in and to get educated on that subject. So for example, we primarily focus on substance abuse prevention, but what we've learned is that in the environment, especially in low wealth communities, that it's not only a problem of substance abuse, there's chronic illness, food insecurity, and access to alcohol.
The effect I hope to have by moving the healthier items higher is to show people, hey, the healthier foods can be good for you too. And besides, like when people go to a store, whenever they usually see the things like up top and in front of the shelves, they think, okay, those are fresh, those are just put out, those are gonna be the better things. The benefits of having fresh fruit options, because it refuels your body, gives you a lot of energy, gives you a lot of life, especially like when you run a busy life, you're moving around every day, having that extra energy helps you. And the more you take care of your body, the longer your body's gonna take care of you, so you're gonna be able to live longer, fight colds and flus longer, so you're gonna stay out of the doctor's office. That saves you a little bit of money there too. And most importantly, the longer you live and the more energy you have, the happier you generally tend to be. And a happier life is always the better life, right?
The effect I hope to have from moving the healthier items higher is that people would recognize them more and they will be more prone to get that instead of the junk food.